So let's get started. And let's start with the introduction so that whoever's a little bit late won't miss out on too much. Hello to everyone joining us literally around the world. It's really great to see people from all over the globe joining us in this really important discussion today. My name is Dr. Noga Schiller, and I am the veterinary medical advisor at BioGal Labs, and we are the producers of VacciCheck. And I'm really excited to be hosting this webinar with Dr. Edward. Dr. Edward is known globally as the healing vet, and through his own recovery from chronic fatigue syndrome, he explored holistic medicine and energy healing and applies it to helping animals. He is the founder of the whole energy body balance method that finds and heals hidden pain, anxiety, and trauma in pets, people, and horses. Dr. Edward practices intuitive veterinary medicine and empowers pet parents and professionals to find and heal silent pain, anxiety, and trauma for their pets and themselves. In this webinar today, I'll be speaking with Dr. Edward about vaccinations and titer testing and how we can evolve and improve our approach to these important topics. So whether you're a pet owner joining us today or a veterinarian, if you're interested in learning more about these topics, you're in the right place. And to those joining now, I will just repeat what I said before, that if you do have any questions during the discussion, please write them in the Q&A box. And at the end, Dr. Edward will try to answer a few of these questions. So Dr. Edward, thanks so much for joining us today.
You're welcome.
Do you want to start out saying a few words before we start with the questions, or do you want to go straight to the questions?
Look, I think disease protection is a really complicated, hard to understand, confusing thing when it comes to keeping our pets safe from disease, in that we have core vaccines and non-core vaccines, but we'll mostly be talking about core vaccines today because they're the deadly diseases. And my kind of personal thing with non-core vaccines is that I need to have a really good reason to use them and a really high risk. But the problem with disease protection is that there's risk from disease and there is risk from vaccination. And we have to, my intention is to help you try and understand all of this so that you can make an informed choice with your animals when it comes to all these things. Where no matter what choice you make, no matter what, when you make a choice, no matter what happens, you'll be confident you still made the best choice, because we can never guarantee that things are going to turn out in the best possible way in medicine and in life with disease. And we often have a rock and a hard place when we're making health decisions, and vaccination is one of those things where there's a rock and a hard place. So we're going to try and navigate that together today in a way that makes sense to everybody, that can help you make the best choices for your animals and not be confused and not be perhaps bullied by vets, because I know I've a number of clients that have felt quite pressured by vets to make choices that they weren't perhaps quite at peace with.
Great. Okay, so we're going to get started. We're going to start from the basics. We're going to start with what are they and how do they work?
Okay, so vaccinations are designed to create immunity from disease. And a vaccination is where an antigen, so an antigen is like an infectious agent, or part of an infectious agent, is introduced into the body of the animal. And the way this antigen is introduced in the body is designed to trigger your pet's body into mounting an immune response against that antigen, that infectious agent, so that there is then production of antibodies and memory cells, and so you have both cellular and antibody immunity. Should be, if you've got an immunocompetent animal that can respond properly to the vaccine, and the very high percentage of animals that have a vaccine will mount an immune response to them. So vaccinations, the core vaccines for our pets these days, the C3 for dogs, F3 for cats, are modified live virus vaccines, which is a virus that has been changed in the lab so that it doesn't make your animal sick, but it's still similar enough to the wild virus that it mounts antibodies that if your animal's then exposed to distemper, canine hepatitis or parvovirus in the case of dogs, then the antibodies in your animal system will grab hold of that disease and wipe it out before it can make your animals sick. Does that make sense, Noga?
Yeah, absolutely. Could you go a little bit more into detail then what happens? Okay, so these antibodies are created and they stay in the body, and then how are they useful for the actual then infection?
Well, the antibodies, if they're what hooks onto the wild virus, the infectious agent, the disease particles, if you want to call them that, and it grabs them, and then the white blood cells can see the antibodies, and the white blood cells come and gobble them all up, and the body digests them before they can get into the cells and reproduce and cause illness.
So could you go a little more into detail? What does it mean if the dog has these antibodies already as opposed to doesn't have these antibodies?
If your dog has adequate levels of antibodies, that means that there is a very strong correlation with adequate levels of antibodies in the blood and protective immunity from disease by challenge with the infectious agents. And that all comes from Dr. Ronald Schultz's research. I don't think he's any longer with us, but he's an American veterinarian who did an extensive amount of research on duration of immunity after vaccination for domestic pets. And his research showed that for the core vaccines, if an animal older than 16 weeks old was vaccinated a single time with a modified live virus vaccine, that they should have a long-lasting immunity of at least 5 to 7 years. And we can prove that immunity by measuring how much antibodies are in the blood. Now, I will just digress a little bit here in that I posted about this week, and some people on my socials are saying, oh, but my vet says that Titer tests are useless because it's just a snapshot in time and tomorrow the antibodies could be gone. And that is complete, utter nonsense. Antibodies in the blood wane very, very slowly. The levels drop off little by little by little over a long time. So if you test your animals every year or every 2 or 3 years, you'll notice that they either stay much the same, or if they are waning, they wane very, very slowly. So that's one of these kind of myths in the veterinary industry where vets have been misinformed, I believe, about that. Antibody testing is a very, very effective way for us to be able to tell if our animals have levels of antibody that provide a protective immunity.
That is a really, really good and important point to make. Yeah, I'm glad you diverted a bit. So for those that are listening that have no idea what a titer test even is, could you explain to them a bit what it is, what we're testing?
So a titer test is where we collect some blood from your pet, and then we run a test on that blood that measures the concentration of antibodies in the blood, the levels of antibodies in the blood. So it's really simple. You only generally need a fairly small amount of blood. And one of the things that I really like about titer testing is you cannot do any harm to your animal by running a titer test. Collecting blood is a relatively non-invasive thing, and you're not bringing anything into your animal system that can cause any harm. Now, vaccinations, though they're generally safe, they absolutely can cause injury and harm. And the reason that I am absolutely passionate about making sure that every animal that I see is titer tested before any revaccination for core vaccinations is that I've seen a number of animals that have been injured and had vaccination injuries from vaccination. And I've had a number of clients who've had animals that have died after vaccination from things like immune-mediated hemolytic anemia, which has been triggered by the vaccination. Now, this might be a very small percentage of animals that are vaccinated, but I got to tell you, when I'm looking at my lovely animals here, I don't care how small the risk is, I don't want to expose them to risk of harm, yeah?
That's a great point. And so could you expand a little bit about how exactly titer tests are done?
Well, either they get sent out to an external lab that runs processes and measures the levels of antibodies, or you can, and this is what I use in my home visit practice, is I use the VacciCheck kits, which are a little in-house kit where you collect a little bit of blood and you get your little thing and you put it in this little pot and wait for the timer, and the next little pot, and it's almost like a kind of photographic development thing where these little sticks have a little spot on them that correlates to each disease, and they go a certain darkness of color in relation to how much of the antibodies are there. So it's in the labs they have machines and things that do all this, but the reason that I'm here and the reason that I've been using the BioGal VacciCheck kits for, I don't know, 10 or 12 years or more now, is that they're super affordable and they're easy, and I can do them within 30 minutes with a client. I don't have to send it off to the lab. And one of the other things that a lot of people say to me is, well, I can't Titer test because these vets are charging $300 or $500 or $600 for it, and it's ridiculously expensive and way more than a vaccination. And a lot of my vets are saying, well, it's so expensive, why don't you just get the vaccination? And this is because most vets send out to external labs, and most vets then have a markup on that. It's an expensive process. So one of the reasons that I wanted to come and talk to all you guys tonight was to say to you, you need to talk to your vets and say, why don't you get this simple, cheap, affordable test in so that you can Titer test my animals and it doesn't cost me the earth, and I can make sure that they have protective levels of antibodies without it being, 10 times more expensive than a vaccination.
Absolutely. So you already kind of touched on this subject, but I do want to maybe repeat it, maybe to get a little more into it. So you get the results of these Titer tests. And I kind of want just to, really explain to these pet owners, what do these results mean? What are they telling us? You did start talking about a really important point of is it just a flash in time, or can it tell us what's going to happen in the next year when it comes to immunity? Just to kind of clarify, what do the results mean?
So with your antibody levels in your pets when you test them, there's kind of like an adequate level. You need to have at least adequate numbers of antibodies in, and this is a concentration that research has shown is a protective level of antibodies. Now, some animals will have much higher concentrations. It doesn't necessarily make them more immune to disease, but it does mean that they'll have a longer duration of immunity before they come down to where they might be getting a bit borderline and getting below adequate levels. So what does it mean? It means that the research that is out there, which is mostly by Dr. Ronald Schultz, but it has been repeated around the world too. So it's not just one-off research. It's research that other people have replicated and proved by repeating the research, which is a really important principle if you're looking at scientific evidence. Is okay, so one person's research is great, but has anyone else been able to replicate that? And all of this work around antibodies and duration of immunity in pets has been replicated. So basically, it's really simple. You do a blood test for your dog or your cat, and if you have adequate levels of antibodies, then they have protection. At least that's what all the research I've read has told me. If they don't have adequate levels, then you have to think about, do we or don't we revaccinate? Now, I know that there was another question there, what is a secondary immune response, which we seem to have skipped over. But the second time an animal gets exposed to a vaccination or the disease, it will stimulate the immune system more strongly than the first time, basically. But you also need to understand that if your animal has a whole lot of antibodies in their system and you inject a vaccine in under the skin, those antibodies grab that vaccine before the body can actually respond to it. So I reckon the term booster is the most misleading term in veterinary science, because the vast majority of animals that have this so-called booster for the core vaccines, it doesn't do anything. It doesn't actually make more antibodies. It just opens your animal up to risk of harm from the vaccination. Now, we do need to be clear that we're talking about that there are different kinds of vaccinations. And this is where it can get a little bit confusing. So we have what are called sterilizing vaccinations, that if your animal has been vaccinated with something like parvovirus, distemper, canine hepatitis, and they get exposed to the disease, they won't develop any symptoms. Then you have non-sterilizing vaccines, and which are more like the flu vaccine for people and kennel cough vaccine for dogs, where your animal may still develop symptoms. They're less likely to get sick from exposure to the disease, but a certain percentage may still develop symptoms, but those symptoms will tend to be less severe than if they're not vaccinated at all. And this is why we can't titer test for kennel cough. It's not worth titer testing for, because it only lasts a year, and antibody levels, because they're a non-sterilizing vaccine, are not as useful. And see, this is where medicine and veterinary science can be really kind of difficult for you who own your pets, because it's like, well, aren't all vaccines the same? Don't they all work in the same way? Don't they all give the... No, they don't. They're all different. Each vaccine has a different profile in terms of how long the duration of immunity is, whether it's a sterilizing or a non-sterilizing vaccination. And if you want a kind of a loose comparison, the MMR vaccine for humans is a bit like the C3 vaccine for dogs. They're both ones that give a long-lasting duration of immunity, and they should be a sterilizing, as in you shouldn't get sick if you get exposed to the thing. And the kennel cough, leptospirosis, and other non-core vaccinations are most often non-sterilizing, and you can't really titer test for them. One big one for people in the USA and Europe where there's rabies is, I get a lot of people say, well, can you titer test for rabies? Well, yes, you can, but a lot of you people are trapped in a situation where it's mandated and legislated that you have to have your rabies vaccinations at certain intervals, no matter whether or not you can prove your animal's got immunity from antibody levels that would give immunity or not, which is kind of tricky and not so helpful.
Really, really, really good points. I do want to go back a little bit to the point of the results, because I think that's a really important point to understand. Also, from my experience with pet owners, sometimes when they get a relatively low score on VacciCheck, compared to a dog that will get high scores, what does that actually mean when it comes to immunity?
Well, from my reading of the research, it doesn't really mean a whole lot. It means as long as you have adequate, you're good to go. And if you've got a dog that's, got adequate and one's a couple of notches higher on the qualitative or quantitative measure, it doesn't really make any difference to your decision making. Your decision making threshold is, does this animal have adequate levels of antibodies? If they have adequate levels of antibodies, then I'm never going to revaccinate an animal that has adequate levels of antibodies. Now, the one in Australia here, often the one disease that will have lower levels of antibodies than the other ones is distemper. And I think that's partly because distemper is practically extinct in most of Australia, except for out in the middle of the desert where there's some camps with semi-feral dogs, and you do have that disease is endemic in those populations. But here, where I live, or in the city, I reckon I might have seen 2 cases of distemper in 30 years in practice. So it's a very rare disease now because of vaccination. So, I talk to people, look, your parvo's good. That's the most important one, because that's the most common one, the most likely to kill your dog. For some reason, infectious hepatitis always seems to be high as well. But these few cases where I get low distemper, then I have a really long talk to the people and say, well, are we going to revaccinate or not? Because we can't split it out. We have to do all 3. That's the other thing about all these vaccinations. There's no such thing as a monovalent vaccine available anymore, because they're all trivalent or polyvalent. And that also is problematic, in my opinion, for upsetting the immune system, because not only are you getting the vaccine going in through under the skin rather than hitting the mucous membranes, which is where the body's evolved to meet it immunologically, but you suddenly got 3 diseases all at once, and the chances of an animal being exposed to a significant load of 3 diseases in the wild all at once is vanishingly rare, and again, they're not evolved to cope with that. So sometimes we might decide not to revaccinate if you've just got a low distemper unless you're going to go somewhere where the risk benefit stacks up.
Yeah, absolutely. I think it's really important to always look at the whole picture of what we're doing, make decisions based on science, make decisions just like you said. It really depends on the location, on the exposure, on the risk, everything.
Yeah.
Most of the things we do in veterinary medicine is weighing the risk and the benefit.
And
And yeah, I think that's a really,
there's just someone in the questions that said, I heard you say sterilizing vaccines are pretty much foolproof and lifelong. I did not say they were lifelong. They generally give a good immunity of at least 5 to 7 years. I just want to be really, really clear about that. Some animals will mount an antibody response that is lifelong, and I suspect that sometimes they are getting a little bit of stimulation from very low levels of wild disease that is keeping their antibody levels up. I don't think it's necessarily all vaccination. And I know that there is some vets in the US that are using low levels, short times of natural exposure and getting seroconversion and protective antibody levels from taking puppies out to really busy dog parks and just putting them on the ground for 5 minutes once a week for 4 weeks. So, vaccinations are not the only way that safe immunity can happen, but it is a lot more risky to take your dog out in the wild, because if you do happen to put your puppy down where a dog in active infection just dumped a big load of virus, then you might have a sick or dead puppy within a short period of time too. It's not without risk. But I really want to be clear, it is not necessarily foolproof. There is a small percentage of animals that won't respond to vaccination and won't mount an antibody response, which is why I like to titer test puppies a month after their 16-week-old vaccination to see if their body has actually made antibodies or not, so that we know if they've got protection. Now, probably 95, 98% of puppies will mount an immune response, but there is a small percentage that won't. And the data and evidence that we have says that you're looking at 5 to 7 years. So probably 5 years is the wiser thing, and mostly I recommend that you start titer testing 3 years out from a modified live virus vaccine and test every year, because I like to be super careful.
Yeah. Yeah, I think that's a really important point, that it's individual. That's also the point of titer testing, is so we can check each individual dog and we can check how their immune system has responded to a vaccination. But I do want to add, like Dr. Edwards said, that there are many studies that have already shown that in most dogs, the 3 core viruses can last for many years. However, this is, again, most dogs, and that is why it is important to titer test, because some dogs, like Dr. Edwards said, their immune system doesn't develop this response as strongly, and they do need their vaccinations. If you have anything more to say about that topic, if not, let's change it a bit to why
Sure.
don't most vets offer titer testing?
There's a few reasons. There's financial pressures. Vaccinations make up a large amount of veterinary hospitals' income. I know way back when I realised all this, must have been 15, 18 years ago, and I stopped just revaccinating according to the guidelines in my home visit practice. I was up in Townsville in North Queensland at that time. I lost 20% of my gross income from that choice.
Wow.
So this is a real problem when it comes to creating change in the industry, because it's a tough industry to be profitable in at all. The veterinary industry, it's a really high overhead, very expensive to run a veterinary hospital, which most veterinary clients don't appreciate, just how stressful and expensive it is to run a veterinary hospital. And vets are the lowest paid profession of all professions, all university professions. We are not well paid. A lot of people think vets make a stack of money too. That's not actually true. We are at the bottom end of the heap when it comes to professions for income. But so I think there's some barriers to titer testing. I think one of them is expense, and one of them is expense because most people have been sending out to external labs, and it is expensive to do that. And this is why I believe the only way that we're going to see significant change in the veterinary industry is pressure from you, from the pet owners, from you talking to your vets and saying, well, come on, there's an affordable way to do Titer testing. Why aren't you offering it? And if you annoy your vet long enough, they might change their behavior. And also there is a whole lot of kind of, I think, also misinformation that a lot of vets have been taught. I get a lot of vets who say, we talked a little bit earlier about some vets saying, well, the Titer test is useless because it's just a snapshot in time and your antibody levels could be gone next week. And in my experience and my reading of the research, it's just not true. Titers don't just suddenly disappear. They slowly fade out over time. And it's a very slow process. And not always do they do that too. I've had a number of animals that I've Titer tested over years and they stay about the same year after year after year. They don't actually fade out at all. So again, every animal is kind of unique. The immune system is unique in how well they can maintain antibody levels. Some won't last as long as others. Some will be really strong and have much longer duration of immunity. Now, we don't really know why that is, but I think most vets, there's a kind of a momentum in the industry that vaccination, there's also, vets have all been taught forever that there's no risk in vaccinations and you should never worry about giving an animal a vaccination because it'll never do any harm. That's a kind of background belief in the profession, in my experience. And I think that's a background belief in the whole medical profession, human as well. There is this inbuilt thing that vaccinations can only do good and don't do harm, even though if you read the inserts and you look at some of the reactions that can happen, it's obvious that they can do harm. There's no doubt about that. And I've worked with a number of animals that have never been the same after a vaccination, that have triggered autoimmune diseases, that have triggered IBD, that have triggered allergies and all sorts of things that quite clearly correlate with a vaccination within a relatively short period of time. So the question is not that vaccinations do harm or good. Vaccinations are highly, highly effective. The core vaccinations are very effective at protecting from disease. There's no doubt about that. But my thing is that Titer testing minimizes the risk of harm to your animals. Minimizes, it means that if you Titer test and you've got adequate antibody levels, then you're not going to give your pet a biological medicine that can cause harm. You're just taking the risk out of the equation by Titer testing.
Great. That was really, really interesting. I'm looking over the questions. I do see some questions also specifically about VacciCheck. So what I want to do is just to really briefly talk about VacciCheck. For those of you who have never heard of this test or have heard but don't completely know what it is. And I will briefly try to answer a couple of the specific questions about VacciCheck. And then I think we're going to turn it back over to you to answer some questions because we did get a lot of questions. So just really quickly, what is VacciCheck? Dr. Edward already started explaining it. It is an in-house test. Now, when we say in-house test in veterinary medicine, we don't mean in the pet owner's house. We do mean that they can be done in veterinary clinics. I also call it in-house test, so I get that question a lot. It means that it can be done in any veterinary clinic, big, small, it doesn't matter. You can do it on the spot. And it's a really quick test to do. And this is really great for two main reasons. First of all, like Dr. Edward had also talked about, it is currently pretty expensive to titer test. And it can really reduce the costs also for veterinarians. And then also that will mean that it can reduce the costs for pet owners. And then the second reason is that you can get results the same day and you'll be able to know on the spot if your dog actually needs another vaccination or not. I will also kind of point out that it does test for our three core viruses. So it'll test for parvovirus, for adenovirus, and for distemper virus. I did get a question here about lepto. So lepto is indeed a core vaccine in many countries in the world right now. However, like Dr. Edward had previously said, they're bundled, the vaccinations, but luckily it should be available to be able to separate those two vaccines. So in most places, I don't want to generalize everywhere, but it should be available basically everywhere, a separate lepto vaccine to the 3 core viruses. When it comes to the test itself, it's really simple test. It only requires a few drops of blood. So it's really minimally invasive and it takes less than half an hour to do. Dr. Edwards started showing it's like you can move it from place to place, but it's a really quick test. A few questions that I got that I do want to try to answer. See what I saw. Okay, I'll leave that one for you. So it's gonna check IgG antibodies. Someone did ask about that, which are the antibodies that are part of our secondary immune response. These are the antibodies that are long lasting. So these are the ones that we do want to check. What is the difference between the in-house titer tests and those done in a lab? And another question was if they're qualitative or quantitative. So they are semi-quantitative tests. That means that you'll get a score from 0 to 6 that will tell us that is parallel to the antibody concentration. That is a little different than lab tests where you'll get a fully quantitative result. But like Dr. Edward explained, when it comes to immunity, it doesn't really matter. What we want to see is that there's adequate levels of antibodies. So we want an adequate score, and that'll be enough for us to know if this dog is still immune or not. And besides that, there aren't really much differences between the in-house titer test and those done in the lab. VacciCheck has been part of many, many studies that have compared what is called the gold standard, which is the lab test that we're going to do, to the VacciCheck kits. And it is a really highly sensitive and specific test. And that means that you can count on the results to be correct. And it's basically parallel to a lab test. So in that way, there aren't many differences. Someone asked here if they can buy the VacciCheck kit and bring it to their vet. So unfortunately, no, it is only sold to veterinarians. However, if you are a pet owner listening to this webinar and your vet doesn't offer VacciCheck, so please send us an email to info@biogal.com with the details of the vet, and we'll happily reach out to share the info. We'll let them know that there are pet owners that are interested in titer testing. And like Dr. Edwards said, the change will come from you. And if you are a vet that's listening to this webinar and you want to give VacciCheck a try, so also just email us and we will connect you with your local distributor since we're all around the world here. So that is about VacciCheck, and I will try to now go over the questions, see how many we can answer. I did see a few interesting ones. So leptospira, if you want to, there are a few questions about leptospira, if you want to briefly talk about the leptospira vaccination.
I think there's also one here too. At what point actual immunity might have waned even if still getting a positive Titer test result? I got to tell you, if you've got adequate antibody levels, that correlates strongly with immunity. That's the answer to that question. If you've got antibodies, your pet should be protected.
We have a question here about cats also, which we did a little bit ignore in this webinar.
Cats are very similar in that the F3 vaccine is a modified live virus vaccine. The core vaccine for cats behaves in much the same way as for dogs. So you can absolutely Titer test for cats in the same way as you do for dogs for your core vaccines. Leptospirosis is challenging. There would have to be a very high risk before I would consider vaccinating my animals for leptospirosis. If I was living up in the far north of Queensland in the cane fields where it's continually wet and there's a lot of rats and rodents, and they're seeing active cases of lepto regularly in the vet clinics up there, then I would vaccinate. But the leptospirus vaccine only covers some serovars. It doesn't cover all the different strains of the wild disease. It tends to be a more reactive vaccine than a lot of the other ones, and it doesn't last terribly long. It only lasts about a year. So the risk benefit, I mean, you can always have a one-on-one Zoom with me if you've got particular circumstances you want to go through. But how the UK veterinary people made lepto a core vaccine, I cannot understand. I don't see any scientific justification for that decision, and I think it's not in the best interest of the animals that every animal in the UK has to be vaccinated for lepto every year. I think I'm vehemently against that one.
Got it. Okay. A couple more questions. If your animal is borderline antibody level, when would you recommending re-titer testing to ensure the immunity doesn't wane before the next annual titer test?
It's a good question. It depends a bit on your appetite for risk. I mean, you could do it, you could wait another year. If you're really worried and you're in a high risk environment, you might retest in 3 months and test every 3 months and see what's going. Is it staying the same? Is it staying steady? Is it becoming less? You have to, again, make it an informed choice depending on the context you're in and the risk of whatever exposure there might be.
Okay, there's a really short, brief question I'll answer quickly. How is BioGal different from the ELISA titer test? So it isn't. The VacciCheck is an ELISA titer test. So I just wanted to clear that up. Do you think titer testing will become standard practice in more clinics in the next few years?
I think that certainly given the response that posts I make about this on my socials have, I think that titer testing is becoming more and more something that people are going to demand of their vets one way or another. And I think the more that we all talk to vets and say, look, I want an affordable, I don't just want a titer test, I want an affordable titer test. And I think that's where the BioGal VacciCheck kits are a great thing, because vet clinics can get them in, they're not expensive, they don't cost them a whole lot of money. And you can run these tests and make a profit and them still be affordable.
Great. This is a really interesting one. If a dog is infected with parvovirus, will it affect the titer test results?
Well, for one, if a dog has parvovirus, if it becomes clinically unwell with parvovirus, then we will know that it didn't have immunity, because if it had immunity, it wouldn't have got sick in the first place. But any animal that recovers from a wild infection with the wild virus will have mounted an antibody response, and you cannot tell the difference between vaccination antibodies and antibodies from parvovirus in the wild. So you can measure them. I believe that wild infection probably gives you a longer, stronger immunity than vaccination. But, 20 or 30% of the animals die of parvo too, so it's not the best way to give them protection.
Okay, we're getting a lot of questions, so let's see if we can answer one or two more. What can pet owners do to encourage their veterinarian to offer VacciCheck in their clinic?
First thing is, I would say when you go into your vet, first thing you say is, thank you so much for caring for my animals and putting so much heart and love into your training to care for animals. Because if you start off with a little bit of sugar, they're going to be much more open to listening to the next thing you say, right? And I think it's great. Vets have the highest suicide rate of any profession. So any appreciation and gratitude you can give your vets literally could save someone's life. So do that. And they're always going to help your animals better if you're nice to them. And then you just say, look, I'm desperate for an affordable Titer test. And I've heard about these BioGal VacciCheck kits, and I want you to get them in so you can test my animals so I don't have to give them unnecessary vaccinations that might cause them harm. I think it's pretty simple.
Great. I think that's a great way to end this webinar. I think we went through most of the questions, at least what I can see. So thank you so much, Dr. Edward. It's been really interesting, really informative. And thank you everyone for joining us. Whoever couldn't join us, you will get the video so you can see it on your own time. And like I had said, we are available via email at info@biogal.com. So everyone can reach out to us for anything. Like we said, we do believe that the change can come from the pet owners, and we are here to help make that change. And thanks a lot. Dr.
Yeah,
Edward, same thing.
yeah. And if you need individualized advice, go to thehealingvet.com and look me up, because I know that everyone has very unique circumstances and risk profiles, and this can all be kind of confusing. Even after we've done an awesome webinar like this, some of you might still be going, well, it still doesn't make sense to me. So I am available for one-on-one sessions if you need.
Amazing. Okay, so thank you so much. Have a great evening in Australia, a great morning in other places of the world. And yeah, thank you so much.
Thank you, everybody.
Bye. Have a great day.